If you're over 60 or even approaching it, and you've ever thought, I should probably get stronger, but I don't want to hurt myself, then this message is especially for you, because there's a quiet truth about aging that many women are never told clearly enough. Strength loss does not announce itself loudly. It happens slowly, almost politely, until one day you notice carrying groceries feels harder, getting up from a chair takes more effort, or your balance doesn't feel as steady as it once did. By the time most women recognize this change, they assume it's just part of getting older. As a surgeon, I can tell you that assumption is one of the biggest reasons independence fades faster than it needs to. Now, even though today's message is focused on women, it's important to understand what happens to the body after 50 in general. Muscle mass declines. Bone density slowly drops. Reaction time changes. Joints become less forgiving if they're not supported by strong muscles. For men, this often shows up as stiffness and loss of power. For women, it often appears as fatigue, weakness, or fear of injury. Different experiences, same underlying issue. Strength is not about appearance. It is about protection. Strong muscles protect the joints. They protect the bones. They protect balance. And most importantly, they protect confidence. Many women avoid strength training because they associate it with heavy weights, gym machines, or aggressive movements. That fear is understandable, but it's also outdated. The kind of strength training that matters after 60 is controlled, precise, and gentle on the joints. It focuses on movements your body uses every single day: standing up, sitting down, carrying, stabilizing yourself when you move. If these movements become difficult, life becomes smaller. What concerns me most as a physician is how often women wait until pain or limitation appears before acting. By then, rebuilding strength becomes harder, though never impossible. That's why the phrase "before it's too late" matters here. Not because there's a deadline, but because the body responds best when strength is maintained rather than rescued. Timing matters, lifestyle matters, and understanding what your body truly needs matters. After 50, muscles need a clear signal to stay strong. Walking alone does not provide that signal. Stretching alone does not provide that signal. Only gentle, consistent resistance tells the body this strength is still needed. Another challenge after 50 is recovery. The body doesn't bounce back the way it once did. That's why smarter timing becomes important. Mid-morning to early afternoon is often ideal for strength work. The joints are warmer. Balance is better. Reaction time is sharper. Early mornings can feel stiff and late evenings can increase fatigue. Lifestyle plays a powerful role as well. Inadequate sleep reduces muscle repair. Low protein intake accelerates muscle loss. Dehydration increases joint discomfort. These are quiet factors that compound over time. I've worked with women who believed their weakness was permanent, only to see them regain strength, confidence, and stability within months by doing the right movements at the right pace. In this series, I'm going to share 3 strength training exercises every woman over 60 should be doing, not because they're trendy, but because they directly support independence, safety, and daily function. They don't require a gym, they don't require heavy equipment, and they don't require pushing through pain. They require consistency, patience, and respect for your body. In the next part, I'll introduce the first exercise. It's one of the most important movements for protecting your legs and hips, and it plays a major role in preventing falls and maintaining confidence as you age. Ask for part 2 when you're ready. Let's begin with the first strength exercise, and I want you to pay close attention because this movement quietly determines how independent you remain as the years go by. This exercise is the controlled sit, to stand. It may look simple, but medically it is one of the most powerful strength indicators we have. If a woman can stand up from a seated position without relying heavily on her arms, her risk of falls, joint strain, and loss of mobility is significantly lower. After 50, the muscles that weaken fastest are the thighs and hips. These muscles protect the knees and stabilize the pelvis. When they weaken, the body compensates by putting stress into the joints and lower back. To perform this movement safely, choose a stable chair with a firm seat. Sit tall with your feet flat on the floor, about hip width apart. Your weight should be evenly distributed across both feet. Before standing, take a slow breath in. As you breathe out, gently lean forward just enough to bring your nose over your toes. Then press through your heels and stand up in a smooth, controlled motion. What matters most here is control. Avoid using momentum. Avoid dropping back into the chair. Lower yourself slowly as if the chair were fragile. This slow lowering is where much of the strength is built. It teaches the muscles to support your body weight safely. If you need support at first, lightly place your hands on the armrests or your thighs. Support is not failure. Support is how the body learns safely. Over time, as strength improves, the reliance on the hands naturally decreases. This exercise strengthens the legs, hips, and core together. It also reinforces balance and coordination, which are often overlooked in traditional exercise routines. Now let's talk about how often to do this movement. 2 to 3 times per week is ideal. On each session, start with a small number of repetitions. Even 5 controlled repetitions are enough in the beginning. Rest between repetitions. There is no need to rush. Timing matters here. Mid-morning or early afternoon tends to be best. Joints are warmer and the nervous system is more alert. Avoid doing this exercise late in the evening when fatigue increases the risk of missteps. Lifestyle habits support this exercise more than most people realize. Adequate protein intake helps the muscles respond to the movement. Hydration keeps the joints moving smoothly. Sleep allows the muscles to rebuild after the signal you've given them. One of the biggest mistakes I see women make is assuming discomfort means harm. Mild muscle effort is normal. Sharp pain is not. The goal is to challenge the muscles without stressing the joints. If you've avoided strength training out of fear, this exercise is where confidence begins. In the next part, I'll introduce the second strength exercise. This one focuses on the upper body and posture, areas that quietly affect balance, breathing, and spinal health as women age. The second strength exercise I want to share often surprises women because it doesn't look like traditional strength training. Yet from a medical standpoint, it plays a critical role in posture, balance, and overall stability after 60. This movement is the wall-supported push. As we age, the muscles of the chest, shoulders, upper back, and arms gradually weaken. When that happens, posture begins to change. The shoulders round forward, the head drifts ahead of the body, and breathing becomes less efficient. Balance is also affected because posture and balance are closely linked. The wall-supported push strengthens these areas without placing stress on the joints. To begin, stand facing a wall at arm's length. Place your hands on the wall at about shoulder height. Your feet should be comfortably apart, and your body should form a straight line from head to heels. Before moving, gently engage your abdominal muscles, as if bracing yourself for a light cough. This helps protect the spine. Slowly bend your elbows and allow your chest to move toward the wall. Keep your elbows angled slightly downward rather than flared out. Then gently press yourself back to the starting position. The movement should be slow and controlled. Avoid locking your elbows at the top. Avoid collapsing at the shoulders at the bottom. This exercise strengthens the arms and shoulders, but just as importantly, it strengthens the muscles that keep you upright. For women after 50, posture strength directly affects confidence and comfort during daily activities. Standing tall reduces neck strain, improves breathing, and enhances balance when walking. Start with a small number of repetitions. Even 6 to 8 controlled movements are effective. Quality matters far more than quantity. This exercise can be done 2 to 3 times per week, and it pairs well with the sit to stand movement you learned earlier. Timing again matters. Avoid doing this exercise when you are rushed or tired. Calm focus improves form and reduces strain. Lifestyle factors influence progress here as well. Poor posture during the day weakens these muscles faster. Take breaks from sitting. Gently reset your posture when you stand or walk. Another important point is mindset. Many women underestimate upper body strength training because they associate it with lifting heavy objects. In reality, functional strength is about control, stability, and endurance. This movement helps protect the shoulders and arms from strain during daily tasks like pushing doors, reaching, or steadying yourself. In the next part, I'll introduce the third and final strength exercise. This one supports balance, bone health, and confidence in movement, especially when walking on uneven surfaces or navigating stairs. The third and final strength exercise focuses on an area that often determines whether a woman feels steady or uncertain as she moves through her day. This movement is the supported single leg balance with gentle lift. Balance is not just about coordination. It is a combination of muscle strength, joint stability, and nervous system awareness. After 50, all three need regular stimulation to remain reliable. To begin, stand near a sturdy surface such as a counter or the back of a chair. Lightly rest one hand on it. This support is there for safety, not to carry your weight. Shift your weight onto one leg. The standing leg should be slightly bent, not locked. This protects the knee and allows the muscles to engage properly. Now gently lift the other foot just an inch or two off the floor. You are not trying to raise it high. You are teaching the body to stabilize. Hold this position for a few seconds while breathing normally. Then slowly lower the foot and switch sides. What matters most is how calm and controlled this feels. If the body shakes slightly, that's normal. It means the muscles and nerves are communicating. As strength improves, you can gently increase the hold time. Even 10 to 15 seconds is effective. This exercise strengthens the hips, thighs, and lower legs. It also supports bone health by placing gentle, controlled load through the standing leg. Balance training like this reduces fall risk more effectively than walking alone. It also improves confidence, which changes how a woman moves in daily life. This movement can be done daily if desired, especially because it is low impact and easy to recover from. Timing again plays a role. Practice balance when you are alert and not fatigued. Late morning or early afternoon remains ideal. Lifestyle habits influence balance more than many realize. Vision health, proper footwear, hydration, and adequate sleep all affect steadiness. One important point is patience. Balance improves gradually. The nervous system adapts over time, not instantly. In the final part, I'll bring everything together and explain how to combine these 3 exercises safely, how often to practice them, and how to support them with simple lifestyle choices that make strength last. Now let's bring everything together, because strength after 60 is not about doing more. It's about doing what truly supports your body. These 3 exercises work best when they are treated as part of daily life, not a separate chore. The controlled sit to stand supports leg and hip strength. The wall-supported push improves posture and upper body stability. The single leg balance movement trains coordination and confidence. You do not need to perform all 3 every day. 2 or 3 sessions per week are enough to maintain and even rebuild strength. On days between, simple walking or gentle movement keeps the joints comfortable. Consistency matters far more than intensity. Small, regular signals tell the body that strength is still required. Timing remains important. Late morning to early afternoon is ideal for most women. The body is warmer, balance is better, and energy levels are more stable. Avoid rushing through exercises when tired or distracted. Lifestyle choices quietly determine results. Sleep allows muscles to recover and bones to strengthen. Adequate hydration supports joint comfort. Regular meals with sufficient protein help muscles respond to training. One common mistake is pushing too hard out of fear of losing strength. That approach often leads to soreness or injury. Progress comes from control, not force. Another mistake is stopping once improvement is noticed. Strength fades quickly when signals disappear. Maintaining strength requires ongoing care, not perfection. As a surgeon, I've seen how small changes make large differences. Women who believed weakness was inevitable regained confidence, stability, and independence by respecting their bodies and staying consistent. It is never too late to begin. But the sooner you start, the more your body has to work with. Strength is not about age. It is about preparation. Support your body now, and it will support you for years to come.